2 ongoing investigations dealing with various allegations that had been received regarding this contract. This was not intended to avoid ventilating the issues in the public space, but were advised to exercise prudence to protect the integrity of these investigations as documents and individuals were being interrogated through a formal and official process by the investigators. These investigations have been conducted by the Special Investigating Unit, SIU, that publicly announced earlier on the year that they were investigating these matters as per presidential proclamation regarding all COVID-19 allegations of corruption. The second investigation, the investigators, Gubane Tax Assurance Advisory Firm, were engaged by the department to look at matters that even predate COVID-19. The scope of the forensic investigation entailed the following. A, determining the method of procurement process followed in the appointment of the service provider, as well as the agreement entered into with the Department of Health and the service provider, and determine whether the agreement and prevailing legislative policy frameworks were adhered to. B, whether the acquisition processes, agreements, and spending were done in accordance with the applicable legislative policy requirements. C, identifying any irregular, unauthorized, and/or fruitless and wasteful expenditure incurred by the officials and associated accountability. D, investigate any other related discrepancies and irregularities identified during the course of the investigation, including but not limited to theft, fraud, and corruption. E, the forensic investigation must cover the work performed by Department of Health, government institutions, service providers, and subcontractors involved, and relevant industry specialists must be consulted when necessary. F, if there are indications that allegations identified may result in disciplinary, criminal, or civil action, this must immediately be reported to the project manager during the course of the forensic investigation in order to consider the necessary action. And G, to review invoices before they are processed for payment and advise if the Department of Health should consider suspending the services pending the outcome of the investigation. We understand that the work of the SIU is ongoing, and as was announced yesterday, the SIU head, Advocate Mkhize, advised the public that the investigation is nearing completion. As the department will continue to cooperate with this investigation, adhere to all their requests for information, and ensure that individuals whom they wish to interview are at their disposal. We will therefore be guided once its findings and outcomes are made available. With regards to the forensic investigation initiated by the department, I can confirm that the draft report was received by Director General on Friday last week. A final report has also been issued this week, Monday, 24th of May. Procedurally, once the Director General received the report, he had to ensure that the copy is also shared with the SIU. I, as Minister, also needed to ensure that a copy of the report is handed over to the President. This is because when this matter came up and my name was linked to it, I had a duty to report to the President, the head of the executive as my superior, and I had an undertaken to keep him appraised. I can confirm that both SIU and the President were given the final report on Tuesday. I think I need to state that given the various actions that are already underway, we have been legally advised that we cannot fully disclose the details of the report at this stage and the plan of action that is already underway. This is because given the seriousness of the findings and intensity of the steps being undertaken, detailed public disclosure may jeopardize remedial action that is being undertaken. In summary, the investigation has found that the tender bidding process followed was in contravention of the Public Finance Management Act. The process of appointing Digital Vibes was irregular. The irregularity findings range from inconsistencies in the bid committees to lack of disclosure of conflict of interest. Secondly, the investigators have found that an amount of some 37 million paid to Digital Vibes constitute fruitless and wasteful expenditure. Thirdly, in respect of COVID-19 related communications work that was performed by Digital Vibes, the investigator noted that the service provider received requests for work from Department of Health prior to the contract being expanded to include COVID-19 communication. These requests resulted in a financial commitment of some 35 million that the Department of Health ended up paying after the expansion was approved. Investigators therefore concluded that any amount which was paid to Digital Vibes for any work done in relation to COVID-19 communication prior to the approval of the expansion to include COVID-19 work was irregular, as the expenditure was incurred in contravention of Treasury regulations. The investigators therefore concluded that the appointment of Digital Vibes was irregular, and as a result, a total of 150 million that was paid to Digital Vibes by Department of Health during the period of 29 January 2020 to February 2021 was therefore irregular expenditure and should therefore be recorded in accordance with the stipulations of PFMA. I can confirm that the Director General has formally reported to the National Treasury as required. I can also confirm that the process of consequence management, that is taking disciplinary action against all implicated individuals, is also underway. Finally, I can also confirm that the legal processes to recover the funds that we believe the department should not have paid has also commenced. As I've already stated above, the details of this process will be disclosed at a later date in order to protect the integrity of these critical actions. We're aware that the question that may arise is whether elements of fraud and corruption were identified in the irregular expenditure. We wish to inform the public that this investigation is still ongoing through a flow of funds analysis that is being conducted. It is this flow of funds analysis that will also confirm if the department was overcharged for services provided by Digital Vibes and quantify it. I'm also aware that the key narrative that has been that this contract was awarded to my associates, and thus inferring that I may have used influence in the awarding of this contract to this said company. In our very first public response to this matter, I did confirm that Ms. Mita had worked in my office as a PA. She then tendered her resignation, citing personal reasons. In fact, the details of her resignations at the time were communicated to me by her direct supervisor, the Chief of Staff. She expressed that the work demands, including travel between Cape Town and Pretoria, as well as frequent traveling abroad, were taking a toll on her personal life, and she wished to focus on family and with time pursue a more stable job aligned to her qualifications and allowing her to be home daily. This was reasonable, and her resignation was accepted. At no point did she disclose that she was joining a company that had been awarded a contract by the department. There was never such a discussion with myself as the minister or any of the ministry officials. It was only after several months of that resignation that I was alerted by my office that Ms. Mita was now working with the communications company. This came about as they reached out to my office to make an appointment to do various TV and radio recordings for the COVID-19 awareness campaign. In relation to Ms. Mater, I confirmed as early as February, when this was asked by a journalist, that indeed we had worked with Ms. Mater when I was in Luthuli House as Treasurer General. The office was required to fulfill various public and stakeholder engagements, coordinate events and meetings. This was not extraordinary. All senior officials of the ANC are supported in such activities by communications office and support staff at Luthuli House. Therefore, I worked with many of these comrades at the time in the fulfillment of my role as TG. I must also clarify that when we contested ANC leadership positions for our national conference in 2017, I did not appoint a personal spokesperson. Many comrades offered their support in their individual capacity. But there was no one, including Ms. Mathe, who was assigned as my personal spokesperson as it had been reported. I also do not regard any of these individuals whose names have been mentioned publicly as personal friends. But they are certainly my comrades. I have worked with them in the ordinary course of my political or official duties, and this is not unusual. As minister, my obligation is to declare any conflict of interest when it arises, and in this instance, I had not identified any conflict of interest. I did not participate in the company's appointment process. I did not in any way influence the selection of employees or consultants of the company. Even at a departmental level, the minister is only informed once the whole procurement and administrative process has been concluded. As the executive authority, he is then notified and asked to approve the overall strategic implementation and program of action and its final financial implications. This only occurs after the administrative processes by the department, bidding and finance committee, confirming that the processes have been followed in line with all the legal prescripts, and confirmation of the budget is available and is being allocated. And lastly, the Director General, as the accounting officer, has also signed off on this. As our practice as ministers, we do not sign any submission that has not met these requirements. This therefore guards against and draws a clear line between administrative and procurement processes of the department and the role of the minister as the executive authority. In relation to both the NHI and COVID response, health is the department that is tasked with and responsible for the implementation of these strategic programs that have been resolved by Cabinet already. As early as 2019, there was a general concern in Cabinet that the messaging and education and communication to the public in relation to the NHI was weak. Government had not properly unpacked its purpose, benefits to the broader society, and concerns raised by various stakeholders had not been addressed. The department was then required to ensure that there's a proper strategic communication strategy. That is how far our interest as political office bearer would go, that there is implementation of such resolutions at an administrative level which complies with all legal requirements. Having said this, Section 217 of the Constitution is very clear. It requires that when an organ of state contracts for goods and services, it must do so in accordance with the principles of fairness, equitability, transparency, competitiveness, and cost effectiveness. It therefore saddens me that we have now find ourselves in a situation where a contract that was supposed to fulfill public good has now violated constitutional principles that were meant to be always adhered to by the department. Excuse me. Personally, I must express my sense of shock at the figures that have now been disclosed in the report as constituting irregular, fruitless, and wasteful expenditure. There's also been a narrative in the media reports that ministry had outsourced its basic functions to a service provider, as the ministry programs are now alleged to have been coordinated by Digital Vibes. From what I'm told, this is based on invoices that the company submitted to the department. I have not had the benefit of seeing these invoices that were paid by the department, but I wish to categorically state that programs of the minister are coordinated directly by the office of the minister in the department. Members of the public will, for example, recall that when COVID-19 hit South Africa, this country subsequently went on a lockdown. I personally dealt directly with the provincial MECs. The ministry team was primarily responsible for the coordinating activities on the ground with those of the relevant provinces. excuse me. All public addresses were prepared and drafted by myself and ministry officials. There are no speeches which were prepared by service provider, and all core content was developed by the Department of Health officials. Given some of these specifics that have since come out in the media as work having been done by Digital Vibes on behalf of the department, I've asked the DG to avail copies of the said invoices to the ministry in order to carefully go through these items that were billed for and flagged, and all those that may have been included as having been done by service provider when they were actually done by the officials internally. Whilst we have also accepted in terms of the investigation report that communications work was done, the analysis and quantification of the value for money is important. And in this regard, my position as minister remains clear and was immediately expressed to the DG on Friday when I had sight of the report. If there's evidence that funds belonging to the states were not used for the intended purpose, these must be recovered without any delay. In conclusion, therefore, I once again urge the media and members of the public to allow these processes to unfold. I acknowledge my responsibility as a public representative to account, and we therefore commit to keeping the public appraised to the extent that it does not compromise the ability of the investigating agents and law enforcement agencies to carry out their duties. If any member of the public has any further evidence that may assist these ongoing independent investigations, we encourage that these processes be supported. Thank you.
Thank you very much, Minister. I'm going to, before we take questions, although Minister, I only actually have one question at this stage, but perhaps we can give the Director General an opportunity to perhaps make any comments or additions before I come to the questions. DG.
Thank you very much, Dr. Manzi, members of the media.
Apologies, DG. We are live, so if I may just request DG to start this video. Thank you.
Thank you very much, Dr. Manzi, and thank you very much, Minister and members of the media. Yes, I would like to concur with the Minister in terms of his expressions as it relates to this matter. I must confirm that, yes, we did in January commission forensic investigator look at the matter, and we have now received the report, which we are now processing. That we have finalized the letter to Treasury to report the irregular expenditure, and we are in the process of instituting some internal disciplinary processes as it relates to this matter. I must, however, say that the report did raise a number of issues, some of them which we have had to deal with. For example, one of the issues that was raised by the report was that the minister, some of the submissions that the minister had to sign were not supposed to be signed by the minister, but by the Director General. We have actually then immediately after that taken an opportunity to get a legal advice to that matter, which we have now received from the Senior Counsel, which actually guides us as a department in line with the PFMA what needs to be done. I must, however, stress that those submissions, none of the submissions do go to the minister without the signature of the accounting officer, who is the Director General. So we are following all the processes as we are speaking, and we've started all the processes, including the process of trying to see that if there's any irregular expenditure, we've appointed the Senior Counsel to actually work with us in terms of a recovery of some of the expenditure. So we must say that as a department, this has been an eye-opener, and in no way was the department deliberately involved in any fruitless or irregular expenditure. Hence, we are putting in corrective measures. We'll be able to take the questions as they come through. Thank you very much, Dr. Mkhize.
Thank you very much, DG. Minister, I do have now a couple of questions, but there is one frequently asked question, and that is, of course, if the minister can just confirm or just say if the minister in any way, shape, or form benefited from the proceeds of this contract. So this is just one that has frequently come up, Minister, before we come to some of the other questions.
Thank you very much. Let me categorically state that I have not personally benefited from this contract. Thank you.
Thank you, Minister. I'm going to, I'm going to just take a question. Okay, no, I'll keep this one for the DG a bit later. I'm going to come to, I think here's another sort of frequently asked question, Minister, but this one it is coming from Tamar Khan. There have been calls for the minister to step aside until the SIU has finalized its investigation. Can the minister respond to that?
We have responded to the question before. The SIU investigation is ongoing, and we have cooperated with the entire investigation. I actually wrote and welcomed the SIU investigation and offered my support immediately, and also ensured that all the members of the department, that are needed by the SIU are invited, that they are available so that the investigation can proceed without any hindrance. We have in this process also made sure that there is no hindrance whatsoever to the investigation. So there's not been a need for us to consider stepping aside, but also we had been doing this investigation earlier than the SIU, and we believe that if there's any concern, because the investigation of the SIU instituted by the president would have been informed if there's any obstruction that is associated with the department. Thank you very much.
Thank you, Minister. I picked up a question from Heidi Jokos at ENCA, also a question that does frequently come up, and that is essentially the minister's extent of oversight. So her question is that did the minister not have any oversight on the matter? And if the minister found the contract awarded was irregular, how was this not picked up before by the minister? The minister has addressed this, but perhaps just to clarify, the extent that the minister actually has of oversight and who actually gets to pick up these issues. Thanks, Minister.
Yes, the management in the department would then oversee the contract, and if they pick up anything, then those would be processed. But if not, the Auditor General would pick up and then raise the issue with the Director General. In this case, that has already happened. And the Director General, once something has been found by the AG that needs investigation, then it of course has briefed the Minister, and the Minister has actually advised that the Director General should go ahead with the investigation. And in this case, it was my specific advice that the Director General get an independent investigation into this. That has happened. So that would say we've covered the full spectrum of oversight by the department, including the checks and balances that are necessary. If any one part of the department missed something, then the next one should be able to pick it up. And in this case, this has happened.
Oh, my apologies, Minister. I was struggling to unmute. I'm just going to come to that question for the DG, and then I think we're going to probably need to close because the Minister does have a commitment. So Yeah, DG, can we just check? I think the DG already has covered this, but just to cover the question. So as of now, has any action been taken against any individual in the department because someone had to approve the digital vibes work, someone had to sign it off? DG?
Thank you very much, Dr. Manzi. Yes, we are currently in the process of instituting some disciplinary actions, and we need to be very sure that we follow the law in terms of this, so that we are not found to be procedurally unfair. And the process is very advanced, and I would like to request the public to just allow us time, but I must just confirm that we will not leave any stone unturned in this matter, and there will be disciplinary action that is that we are currently processing, following all the legal processes that are there in terms of the labor law. Yes, we will be taking action. Thank you, Dr. Manzi.
Thank you very much, DG. Minister, would the Minister like to perhaps make some final remarks before we close, as we do need to allow the Minister to leave?
No, thank you very much. At this point, I would just make one comment, and that is we have gone through a process of investigation. One of the questions that keeps arising sometimes is about whether our comrades can participate in any of the contracts. As far as I would be concerned, the most important thing is to make sure that the processes are done properly, and therefore, any conflict of interest declared, and that, you know, in the department where I work, I found a lot of people that I grew up with, that I went to school with, that I've worked with in the various aspects of the Department of Health as professionals that have, you know, had to be appointed for various roles and positions. And this, for me, as long as the processes have been done properly, there is nothing unusual. And therefore, if any one person is known, or if any person has been associated with the department, those kinds of situations, we need to guard against any, you know, conflict of interest. But if all the processes have been done properly, I don't find anything that's a problem with that. I think what's important is just to make sure that we guard our processes, that the integrity of the appointments is above board, and that would be important. But having said all of this, I want to just say thank you to the members of the public and the media, that when there's any new information in the future, we'll make this available to the public. Thank you very much for your attention. Thanks.
Thank you, Minister. We really appreciate that the Minister has given us this time this morning. And with that, we can close the briefing now. Thank you, Minister, and thank you, DG, as well.